Imagine this. You are standing on a luxury cruise ship in the middle of the endless ocean. Everything feels calm, safe, normal. People are eating, laughing, walking the decks, enjoying the view. But somewhere on that ship, something invisible is already moving. No alarm, no warning, no screams. Just a virus passing quietly from one person to another. And by the time anyone understands what is happening, 8 people are infected, and 3 are already dead. This is not a movie. This is May 2026, and this is the story of Hantavirus. Most people have never even heard the name, and that is what makes it terrifying. Hantavirus has been around for decades. It was first identified near the Hantan River in Korea, but since then, it has been hiding across the world inside rodents, mice, rats, deer mice, living in forests, fields, sheds, abandoned buildings, basements, and dark corners where humans rarely look. Most of the time it stays silent, but it is always there, waiting. And the way it spreads is frighteningly simple. An infected mouse urinates in a shed. Days pass, the urine dries, the droppings dry. Then someone walks in and sweeps the floor. Dust rises into the air. They breathe it in. That's it. No bite, no direct contact, no warning, just one breath. The virus enters the lungs, and for weeks nothing happens. You feel normal. You go to work, you meet people, you live your life. Then suddenly the symptoms begin. Fever, fatigue, severe muscle pain, pain in the back, hips, and thighs. At first it feels like the flu, but then it changes. Your breathing gets harder. Your lungs begin to fill. Oxygen levels drop. Doctors rush you into intensive care. And the worst part? There is no specific cure, no approved vaccine, no simple treatment. Doctors can only support your body and hope you survive. In the Americas, once hantavirus reaches the severe lung stage, around 38% of patients die. Nearly 4 out of 10. Let that sink in. Now back to the cruise ship. On May 2, 2026, the World Health Organization received an alarming report. Passengers on the MV Hondius, a Dutch cruise ship in the South Atlantic, were falling seriously ill with respiratory symptoms. By May 8th, 8 people had been confirmed infected. 3 were dead. The strain was identified as antiviral, a dangerous type of hantavirus found in South America. And this is where the story becomes even more disturbing. Most hantavirus strains spread from rodents to humans. But antivirus is different. It is the only known hantavirus strain that can spread from person to person, not easily like COVID. Not through casual contact in seconds, but through close, repeated contact. Saliva, body fluids, shared utensils, contaminated bedding, long exposure in enclosed spaces. Now imagine that on a cruise ship. Shared rooms, shared dining areas, shared air, 147 passengers. A floating, isolated environment in the middle of the ocean. That is exactly why experts were concerned. So here's the part everyone needs to understand. If someone is suspected or confirmed to have antivirus, distance is not rude. Distance is protection. A kiss, a shared glass, touching infected bedding, and then touching your face. These can become real risks. Even healthcare workers have been infected while treating antivirus patients. The CDC advises avoiding close physical contact, not sharing utensils, wearing an N95 mask, and keeping distance from suspected or confirmed cases. And the scary part is the incubation period. It can take 4 to 42 days before symptoms appear. That means someone can be infected and still look completely fine. No fever, no cough, no warning sign. But once symptoms begin, the risk becomes serious. And because there is no specific antiviral treatment and no vaccine, the strongest weapon is simple: avoid exposure before it happens. Now, is this the next pandemic? Probably not. At least not right now. The WHO currently considers the global risk low. Hantavirus does not spread as easily as COVID-19. But that does not mean it should be ignored. In a past Argentine outbreak, one infected person was estimated to infect around 2 others before control measures brought transmission down. That means action matters, distance matters, awareness matters. And the bigger picture is even more worrying. Every year, tens of thousands of hantavirus infections happen worldwide, and many are mistaken for normal flu. As climate change shifts rodent populations into new areas and deforestation pushes humans closer to wildlife, the chances of new outbreaks increase. In today's world, a virus does not need to travel far on its own. It just needs one infected person on a ship, one passenger on a plane, one family member in close contact. So what should you do? If you live near forests, fields, farms, sheds, or places with rodent activity, take it seriously. Seal gaps in your home. Keep food covered. Do not let rodents nest near you. And if you find droppings, never sweep them dry. Use gloves, wear a mask, spray disinfectant, and clean carefully. Dust can be dangerous. And if you develop fever, deep body aches, and breathing problems after being near rodents, or after close contact with someone who recently came from a risk area, go to a doctor immediately. Tell them clearly about the exposure. Do not wait. With hantavirus, time can make the difference between survival and tragedy. Hantavirus is not new, but in a connected world, old threats can return in new ways. 3 people died on a ship in the Atlantic in May 2026, far from home, far from their families, from a virus carried by a mouse, hidden in dust, carried in a breath. Nature does not always announce danger with thunder. Sometimes it whispers. And by the time we hear the whisper clearly, it may already be too late. Stay aware, stay safe, and share this with someone who needs to know.